Hello, I'm Debbie Wood, AISMA Chairman and Healthcare Services Partner at MHA Moore & Smalley. In this AISMA Practice Index Finance Clinic, I've been asked, what should I be thinking about when looking at my 3-year rolling cash flow and trying to work out the impact of income protection on the years afterwards? Well, it's good to know that you're planning ahead and monitoring cash flow for your practice. It's not always easy to know what to expect, but using the previous year's cash flow is a really good starting point. However, we all know that this 2020-21 year is not a typical year. That means you might need to take out any one-off income and expenditure that has taken place in the current year. For example, the COVID costs and reimbursements. Consider the timing of the income and expenditure that has been incurred, because the pattern for the following year might not be the same. There are a number of income streams that have been protected in this year, even if the usual work hasn't been done, but that overall level of contract income is still a good basis for rolling forward. There will always be some income streams that have been lost as well due to the pandemic this year, for example, some private medical report work and so on. Don't forget to factor that back in again, perhaps on a conservative basis initially for 21-22, as the pandemic is obviously continuing at the moment. Try to set your budget as realistically as possible, taking into account known or expected changes. Have in mind the level of buffer or contingency fund that you want to keep in the bank account, just in case things don't go as intended. As I am speaking to you now, we've not yet had all the financial details for the contract payments due from April 2021, but you can adapt your plan when those figures are known. In the meantime, consider what staff costs and other resources you will need to pay for to meet the ongoing expected contract workload. We do know that a lot of funding is being uplifted in the coming years. There is the NHS long-term plan with a 5-year funding commitment, so you can always look at the details behind that to see what levels of funding are coming into primary care overall, to give you an indication of what to expect. And in particular, be aware of significant funding that's going to be going through the primary care networks. In particular, the additional roles reimbursement funding has almost doubled in the coming year. And there are ongoing continuing initiatives to support GP recruitment and retention. So if you're planning to have a new partner coming into the practice, factor in the new to partnership premium payments. There's a change in the way that your childhood immunisation programme is being funded. So you need to remove that current income stream, which is paid on a quarterly basis through the DES and item of service arrangements. Take that out of your plan for this year and include instead the funding that's being put into the QOF system and the indicators around the vaccination schemes there. Those QOF payments will obviously be monthly with a balancing payment, so the cash flow impact is changing. There will also be additional funding coming through into QOF, £24 million overall in the coming year to support mental health initiatives. We think towards the end of the year, or perhaps halfway through the year, there will be some new enhanced service funding income to factor in as well regarding obesity and weight management initiatives. Have a think about whether or not there's funding that's held at PCN level that may find its way back to the practice, how you will access that money and when. And also think about whether some of the staffing resources that you need are effectively going to be covered through the ARR scheme, paid for across the PCN network, and that you don't have to find that money directly out of your practice funding. The investment and impact fund that's available through the primary care networks as well. Again, significant funding in place for that in the coming years, and also within that funding incentives to be paid back out to practices for reinvestment in patient services. Don't forget that some of the one-off funding that you will have been receiving in this last financial quarter of this year may not continue beyond April. in particular the Capacity Expansion Fund resource and the current COVID vaccination service arrangements. As that income can't be guaranteed, we'd recommend not including that at this stage in your forward plans. So setting budgets, it's never an exact science, but having a plan definitely helps to minimise the impact of unknowns affecting your cash flow. It gives you targets to work to, and the plan can be updated as more information becomes available. Please don't hesitate to get in touch with one of your AISMA members locally should you need any further advice on this particular finance topic. Thank you for watching.